Question 44. Which of the following long-term complications is most directly associated with this patient's condition? Left ventricular dysfunction, thromboemboli, blah, 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 secondary polycythemia. Okay, so maybe heme, cardio, or respiratory? Maybe? That's what I'm thinking. 56-year-old man presents with fatigue and morning headaches. His wife reports loud snoring. That is pathognomonic. And observed episodes where he stops breathing. Okay, so they're giving away the whole bag here in this question. It's really not a secret. This is obstructive sleep apnea. He has a history of hypertension and takes lisinopril. Okay, hypertension, possibly from the OSA. Physical exam shows a crowded oropharynx and a thick neck. Again, just things that cause OSA. Overnight oximetry reveals multiple episodes of oxygen desat during sleeping, polysomnography, apnea, hypopnea. This is all really redundant, useless information. You don't need any of it. Which of the following long-term complications is most directly associated with this patient's condition? Okay, long-term complications of OSA, left ventricular systolic dysfunction. Okay, that's interesting. So with OSA, you tend to get hypoxic lungs and you get hypoxic vasoconstriction. So if this is the right side of the heart, specifically, this is the right ventricle leading into the pulmonary trunk and arteries, right? The lungs are on either side here. With hypoxic vasoconstriction, it's going to increase the pressure in both of these lungs. So blood is no longer going to be able to enter them as easily because there's so much extra pressure. So you can get cardiac side effects in terms of cor pulmonale from the lungs, but that's on the right side of the heart. They're talking about left, right? So we're not really thinking left here, we're thinking right. And even so, this would cause the right ventricle to need to use more force. So this would result in right ventricular hypertrophy to overcome this increased pressure. This is talking about ventricular systolic dysfunction. Systolic dysfunction is trouble ejecting the blood. So this is dilated cardiomyopathy, not hypertrophic cardiomyopathy. So this is wrong for two reasons. Chronic thromboembolic disease really doesn't make a lot of sense. That's for hemostasis. DVT, PE doesn't really apply here. Secondary polycythemia. This is interesting. So again, going back to our example here, right? The hypoxic vasoconstriction in the lungs, the vasoconstriction happens because you have low O2. So because you have low O2, you get hypoxic vasoconstriction, which increases pressure, blah, blah, blah. But if you have low O2, you might also then be undergoing secondary polycythemia to try and retain as much oxygen as possible. So this one's looking pretty good. Again, the polycythemia making more red blood cells is secondary in this case to having low oxygen because of the breathing during sleep interruptions. Hypersensitivity pneumonitis, if you watch the other video, this is about exposure to organic antigens, usually from strange work exposures like working at a lumber mill or working on a farm around animals. So that one doesn't make sense. Increased risk of spontaneous pneumo. Spontaneous pneumo typically occurs when you have blebs in your lungs. So think about like tall, thin people are at risk for this and people with COPD, but again, doesn't apply in this case. So the correct answer here is this guy doesn't have much O2, so he's going to make a lot of red blood cells to hold on to as much as possible. Correct answer is C, secondary polycythemia.